Hello and welcome to the Empowerment series. Videos meant to encourage parents of children with cerebral palsy or families raising children with cerebral palsy to empower them in how they handle their children. Today, we want to talk about doing therapy at home. What does it involve and how can we do it effectively? Let me first define physiotherapy. We all know that physiotherapy is the main thing that we need to do for our children in order for them to achieve movement. I'm defining it from a layman's perspective. So, from a mother's perspective, physiotherapy is the application of knowledge and skills to help restore movement and function, in our case, to a child with cerebral palsy. So, at the core of physiotherapy, I think, is a person's involvement. So, your child is important to the success of physiotherapy. That is, whether physiotherapy will work for your child. We know it works. In their own care, the child has to be involved in their own care through education, awareness, empowerment, and participation in their own treatment. So, the child needs to know that what you are doing with him or her could help her improve. So it's important that you let the child know and understand what you are doing with her. So if your child is not sitting and you put your child in a box or in a chair or in a corner chair, it's important that you speak to the child. Oh, Angel, I need you to sit, and that is why I'm putting you in this child. Do not let therapy seem like work or punishment to the child. So, what do I mean by home based care or home based therapy? Given the number of limited pediatric physiotherapists in Ghana, we know that there are physiotherapists in Ghana, but not many are specialized in the handling of children, more so handling of children with cerebral palsy. It gets a bit overwhelming when you go to see a professional and you don't seem to know whether the person knows and understands what he or she is doing or not. So one of the things that the Special Mothers Project is championing is home-based physiotherapy, where the mother is trained to be able to handle their children. The Special Mothers Project believes that it is important that a mother or a primary caregiver of a child with cerebral palsy is skilled to do regular and consistent therapy with their children at home. The project has taken steps on this by having regular workshops with parents and professionals to train and give them the skills. We did our very first one with Share Care. We did quite a number with multi kits. We've done some on our own as an organization. The recent one being Dr. Abna Tano coming in to teach us what we could do, practical things we could do with our children at home that constitute therapy. That video is on YouTube. So if you missed that meeting, you could go back and listen to what was said and all. Due to the limitations, that is, in terms of how we move, we've decided to be doing these kind of videos to also encourage parents to be doing it regularly at home through these videos from a parent's perspective. So, home-based therapy. One may ask, what can I do with my child at home? My child has cerebral palsy. May I say that you cannot manage cerebral palsy wholly at the hospital. You can't live in the hospital all your life. You know that cerebral palsy is a lifelong thing. It needs lifelong management. So at a point, the primary caregiver needs to be skilled and empowered to do this. So, for example, if your child doesn't have leg control yet, what are some of the things you can do with your child? The last time Dr. Turner taught us about putting the child on something, maybe a pillow, the upper part of the child on the pillow, and then you place a mirror in front of the child. And as the child tries to raise the neck to see him or herself in the mirror, you are doing something. The child will be strengthening the neck. You know, if your child is not sitting, putting the child in an appropriate chair, 30 minutes, 15 minutes every day, and then increasing it as it goes on. It's therapy. Crawling exercises, standing exercises. If you have corners in your homes, you will put your child there, stand in front of the child, and see if that is depending on what stage your child is. You try to work with the child. There are a range of things you could do at home with your child. Getting the child to sit, tearing pieces of papers, trying to pick up things, improving the fine motor skills, trying crawling positions with your child, etc. You know your child better than anybody else. And so you can figure out something that you can do with your child that also constitutes therapy or exercise. Please note, I'm not saying that a professional physiotherapy is not needed. That is not what I'm saying. I'm saying that we definitely need the professionals in deciding perhaps what steps. So your child is not sitting. You've gone to see the professional. They've taught you that, oh, let the child sit. Do your best at home with the child consistently. You know, go back to the professional after 3 months, 4 months, and ask for what next, what steps. You need the professionals to guide you to do it effectively at home. But while we wait for the next steps, we need to get something doing with our children. Many of the children are not in school, so parents, primary caregivers, mothers tend to spend the most time with the children. And you cannot just be there at home and doing nothing, only waiting to go to the hospital to be taught what to do. So try and make therapy fun for your child. Remember that you can do your bit as a parent to give your child the right movement that she needs. I hope it makes sense. Thank you very much. Thanks for watching. You can follow me on Facebook, Special Mothers Project in Ghana, or Hanawaji. We are also on Twitter, LinkedIn, with the handle Hanawaji or Special Moms. Thank you.